Good morning and welcome back. We are at day 12 of 12 days of ICD-10 PCS coding. We are looking at our last three root operations, which is group number 9, root operations that define other objectives. And so these three root operations are really, to me, kind of the easiest ones because fusion is where we're binding, joining something together. Alteration is one of those procedures that most of us associate with a cosmetic appearance. And then we also have creation. Now, the definition of creation has actually changed since the inception of ICD-10. It's funny to say the inception of ICD-10. I was telling someone that I learned ICD-10 in 2010, and it's just amazing um, how far we have come. All right, so let's jump right into our first scenario. And in this particular case, this is a little longer, so let's summarize real quick. So this patient has a posterior lumbar interbody fusion, anterior column L2 to 3 and L3 to 4. One of the things that you've heard me say consistently, I'm going to reiterate today, it's so important that you know what you're coding. I had a conversation with someone yesterday who is, let's just say, a clinician. And there is this, let's just call it misunderstanding about what we do. And so, any chance I get, even though I'm not a day to day coder, any chance I get, I take the opportunity to educate others on the work that we do. The fact that we have had anatomy and physiology and pharmacology and medical terminology and disease process. Because I think when you hear the term biller coder, it doesn't carry as much weight as like a nurse, physician, um, a physician assistant. And we've got to change that narrative because the work that we do is so important. And people need to recognize who we are and who we serve. All right. So, using a back threaded fusion cages and Danic pedicle screws with an autogenous bone graft. We've seen autogenous before, auto meaning self, it came from the patient's own body. So, normal stuff happened. Prepped, draped, usual fashion, anesthesia was administered. And just to the left of the midline of the posterior spinous process of L2 through 4, an incision was made and carried down through the skin and subcutaneous tissue, resulting in exposing the back of the spinal cord. So by now, you should have figured out this procedure is on the back. So using the same incision, so we know how they got in there, dissection was made to identify the PSIF, and bone was harvested from the left iliac crest. Laminectomy was performed. Next was harvested from the iliac crest. Hey, I feel like I went backwards. Next, the fusion was completed using posterior lumbar interbody technique using the back instrumentation. Then the discs were incised to make a hole in the disc space. Spacers were put in sequentially. The back was then selected and packed with bone graft obtained earlier from the iliac crest. After insertion of the back instrumentation first into L2 to 3 and L3 to 4, the pedicle screw instrumentation was inserted to augment the stabilization. The pedicle screw was put into L2 and 4, vertebral body on both sides, and then they locked it in with some rods. And then, of course, they closed the patient up. So there are two distinct procedures that took place today. First, there was a fusion of the lumbar vertebral area. And then there was an excision of the pelvic bone on the left side. That's the autogenous bone graft. So let's, of course, dig into our coding manual. And we are going to go to the index, of course. And in the index, we're going to go to fusion. Maybe I should have went backwards this time. All right, fusion. And then fusion of what? Fusion of the lumbar vertebral. All right. So fusion of the lumbar vertebral, 2 or more, gives us 0 S G. And then we're going to click on that table. And the next thing we have to do, of course, is see what column we're going to be in, because we notice that lumbar vertebral is listed in the first row and the second row. And we go to the approach. Open is listed in both rows. So we're not done yet because our patient's approach was open. So then where do we go from there? What's going to change our direction? Well, our patient had an interbody fusion device inserted. So that's going to give us the letter A. And then our final character is going to be J for posterior column, making our final code for the lumbar fusion 0SG10A and J. We're not done yet. We got to capture that bone graft that was done. And so we are going to go to the root operation of excision. And I think I'm going to work backwards just because I don't want to be scrolling forever. So let's see. Excision, that's extraction, 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 extirpation. See, every time I go backwards, I should have went forward. Okay, excision. And I think when you go to excision bone, it sends you somewhere else. So let's take a look. And if you hear some noise in the background, my special needs daughter, who will be 32 in a few months, is home with me. She is one of the major reasons that I do what I do, because when I had her at 30 days before my 19th birthday, some people thought my life was over. In fact, sometimes I thought my life was over. But here we are, almost 32 years later. It took her 7 years to walk. She doesn't hear, but she makes all of these noises and is living her best life. All right, so when we go to bone and then pelvic, actually, we can go to bone and then pelvic. So that takes us to table. This was the left side. 0QB. 0QB. So I'm going to click it. And 0QB. And our body part is 3 for a pelvic bone left. We know our approach was open, no device, and no qualifier. Final code 0QB30ZZ. All right, that was a long one. On to our next scenario. Augmentation mammography or mammoplasty. So alteration is something that is generally known to be done for cosmetic purposes. So, general anesthesia was, of course, provided. They were prepped and draped. And the procedure started on the left side with 4 centimeter incision being made under the breast. Hey, Stephanie, I believe that you won a prize and my assistant did not hear from you. So let me just pause for a second. And if you want to claim your prize, I'm going to give you my assistant's email address. Please send her an email with your mailing address and you will get a prize in the mail. All right. So, and I think somebody else got a prize. Let's see. I think Natasha was one of the first winners, and Natasha got a prize. I don't know, a couple of days ago. I can't keep track of that. All right. So let's get back to our scenario. So the procedure was started on the left-hand side with a 4 centimeter incision being made under the breast. The pectoralis major muscle was elevated down to the subcutaneous layer. The pectoralis major muscle was elevated off the chest wall, and the medial pectoralis attachments were dissected, creating a pocket. Attention was then turned to the right side with the same procedure being performed, and then attention was turned back to the left side. And a 250 cc McGon style 468 implant was selected. This was emptied of all the air, checked for leaks, and then the implant was rolled into position through the inflammatory incision and unfurled. The implant was then inflated to 310 cc's and approximately positioned. Then they did the same thing on the right side and they closed the patient up. So, what did our patient have today? This is known as an alteration. There are some rules, some guidelines regarding alterations and cosmetic procedures, but in our 12 days of ICD-10-PCS, we don't have time to go over guidelines. So I trust that you will read those guidelines. So root operation is alteration on the breast. This was on the left and right side. So we're going to go to table 0H0V. And this is a small table. They next want to know, is the procedure open? And it is open or percutaneous. Ours was open. Then they want to know, well, what was put inside? It was the synthetic substitute and no qualifier, final code 0H0V0J0 or JZ. I feel like I'm playing a bingo game. All right. Our last root operation is creation. And I, just like one of the other scenarios, I didn't have a scenario in my repertoire for the newest option that was available for creation. And so I was like, okay, I got to use my best friend, aka Chat GPT, to help me come up with the scenario. So this is kind of a partial scenario, but it will get us to what we need to accomplish. So in the surgical suite, a skilled cardiothoracic surgeon prepares to perform a specialized cardiac procedure on a 3-year-old patient who has congenital heart defect. And the patient presents with a common arterioventricular valve that's causing significant regurgitation and impaired heart function. So the goal of this procedure is to create separate left and right arterial venous valves, arterial ventricular valves from the common AV valve to restore proper cardiac function. So I'm going to stop here and go on over to the code book because, like I said, I didn't have um, a scenario in my bank for this procedure. But what we're going to do is just go on the wings of imagination and say we have everything. So the first thing is notice for creation, there's only two options because there's only two reasons that we can use the root operation of creation. One is for gender reassignment surgery or for cardiac valves. So we're talking about cardiac valves. And so that's going to take us to table 0 to F. And so for this particular procedure, if we actually had the entire documentation, because one of the things that we're missing is what body part was involved. We know that the common aortic valve or common arterial ventricular valve was a part of the procedure, but we're really missing a lot of information to fully code the procedure. But I just wanted to have something to show you today. All right, so who do we have in our viewing room today? We got Natasha and Stephanie that we've seen a lot. We have Sonia Bailey from Baltimore, Maryland. Hey, I was in Baltimore, Maryland earlier this year. Who else do we have in the room today? I think there are 7 of you listening in. So let's see here. Who else is in the building? I'm going to play some music while I'm waiting on them to come in. Or maybe not that same music. Let's see who else is here. Whoa, we got Puerto Rico in the house. I love it. That's the one thing about the virtual world. You can meet people from all over the world, but Puerto Rico is in the United States. I love Puerto Rico. Love, love, love Puerto Rico. Who else do we have here? We got Stephanie. Or Stephanie has already been here. We got Zoma. Okay, well, I got a busy day today. So let's see. Sonia and Zelma, I have a prize for you. Please send your information to my assistant, your mailing address, and I have a prize for you. The rest of you, you can have this same prize, but you have to purchase it. My book, the ICD-10 CM Coding Concepts, is a review guide. It is not a, what do you call it? It's not a textbook, right? Where you're reading about the guidelines. You actually are answering questions about the guidelines. So if you are preparing for a national exam, this is definitely a reference for you. And Zelma and Sonia, make sure you do it today, because after today, yours truly is offline and will not return back online until late. First, I was going to say late January, but that's wrong. First week, the end of the first week of January. Well, it's been fun, fun, fun. Okay, Zelma, this will be a perfect resource for you. Well, this has been fun, fun, fun. Definitely, I'm happy to see day 12 come because that means that it's time for me to go away and get some much needed rest, relaxation, reflections, all the things. And in case you guys do not know, on Wednesday evenings, I do a 30-minute growth session. And during this 30-minute growth session, we talk about a variety of topics. Sometimes I have guests, sometimes I don't have guests, but nonetheless, definitely something that is inspirational, motivational. And for 2024, I will be interviewing individuals that have written books. And so it is going to be a good time. So I will see all of you over in 2024. Everybody have a great day.